Positioning of clients. There are different types of positioning based on the different needs and disease conditions of the patients. Basically, the bed positions and patient position are both discussed in relation to the patient's care in this lecture. First of all, let's start with different bed positions. Flat bed or supine or dorsal recumbent position. Here, the patient lies flat on the bed with their back. Sometimes the position can be varied with pillows placed to elevate head and shoulders. This position is used for general body exam, surgery of abdominal and thoracic areas, and also one of the most common positions. Having said that, please also note that this position is also quite common for the development of pressure ulcers, so a change of position and body massage is often preferred for patients who are under long bed rests. Fowler's position. Fowler's position is also called semi-supine or semi-sitting position. In this position, the head is elevated by some angle of legs. This is not like reverse Trendelenburg's position, which doesn't have any angle of the body with legs. According to the angle made, the Fowler's position can be divided into following types. First of all, we have low Fowler's position in which head of the bed is raised by 15 to 30 degrees. Semi-Fowler's, in which head of the bed is raised by 30 to 45 degrees. Standard Fowler's, in which head of the bed is raised by 45 to 60 degrees. High or full Fowler's position in which head of the bed is raised by a full 90 degrees. Basically, Fowler's position is the position of choice in respiratory distress syndrome, as this allows for better expansion of the lungs and ease of breathing. This is also useful for proper neck alignment and for patients who are on nasogastric tubes. Trendelenburg's position. In this position, the head of the bed lies close to the floor while the end of the bed is elevated, making an angle of 15 to 30 degrees. The hands and legs are normally put at the side. So, when is this position selected? This is a common position used during lower abdominal surgeries and central venous catheter placement. This position is selected if some drainage or clearance is required from the postural lobes of the lungs. This position is also used to treat low cardiac output. This position also helps to reduce leg swelling and to help move heavy patients up in bed. There are also some indications in which this bed position is not selected. We should be very careful about this. It may cause elevated intracranial pressure and impaired lung mechanics, so this position should not be used in lung disorders. Here is a quick question for you to solve. A nurse needs to clear the drainage from the postural lobes of lung due to some conditions. Which of the following position would she put the patient in? Your options are Fowler's position, semi-Fowler's position, Trendelenburg's position, reverse Trendelenburg's position. The answer to this question is Trendelenburg's position. I hope you got that right. I suggest you to revise the theory if you are confused. Reverse Trendelenburg's position. As the name suggests, it is just the reverse of Trendelenburg's position. Here, the head is elevated whereas the end of the bed is lowered. Basically, this position is selected to prevent esophageal reflux and promote emptying of the stomach. This can also be used to prevent orthostatic hypotension, as a sudden change of position may lead to orthostatic hypotension. Prone position. In this position, patient is kept with abdomen touching the floor and head turned aside. In prone position, the patient lies on the abdomen with their head turned to one side and the hips are not flexed. It helps to make breathing easier. We may have known that patients with low oxygen saturation during COVID-19 crisis were often kept in the prone position. It is also useful for sedated patients requiring a breathing machine. So what could be the uses or benefits of prone position? Besides making breathing easier, it also helps in the full extension of the hip and knees. It also helps in making better drainage from the lungs in certain lung conditions. Besides this, it can also be used for neurosurgery in most neck and spine surgeries. When should this position not used? The prone position should not be used for patients with spine surgery or spine problems, as this may affect the spine alignment. Orthopneic or tripod position. This position is generally suitable for people who have difficulty in breathing and exhaling. In this position, the patient sits on the bed with their legs extended and head rested on the pillows of the bed table. Lateral position. This is the position that is preferred generally to the patients who are kept in long-term Fowler's and dorsal recumbent or flat position. Here, the patient lies on one of the lateral sides with one leg's hip and knee flexed and kept over the other. This allows good body weight distribution and thus relieves pressure for people who are kept in Fowler's or flat position. Pillows may be necessary to support the leg in this position. Lithotomy position. Another position is the lithotomy position, which is quite common for childbirth and vaginal examination. In this position, the patient is kept supine, but there is some angle with hips and the bent thighs with knees bent, thus exposing the pubic area. Well, that's it. We just covered the lecture on the positioning of the patients. I will give you some time to review these important points. You can even pause and memorize the positions in relation to the different needs of the patient.